Good morning, all. I actually have a video to show, so could you please play my video?
There was a time when phones were used simply to make phone calls. Then came this moment, courtesy of the late, great Steve Jobs.
An iPod, a phone. Are you getting it or not? 3 separate devices. This is one device, and we are calling it iPhone.
The world changed that day and never looked back. Smartphones now run our lives, and we have seen smartphone-aided examination and documentation emerging as a new wave in modern-day ophthalmology. We have published of a do-it-yourself device used in conjunction with smartphones for blue light photography of fluorescent-stained corneas, and this device was used to capture high-definition videos and images of multiple corneal pathologies. We extended its use to the world of contact lenses. Optimum contact lens fitting is crucial for long-term safety and compliance, and fitting by assessing fluorescent pattern has been in use since rigid contact lens came into market. We pit our device against the OG slit lamp microscope. We assess contact lens fit using fluorescent staining patterns of 128 eyes using our do-it-yourself device and compared it to slit lamp imaging. The images obtained from both the slit lamp and the do-it-yourself device were randomized and transferred to an iPad, and an independent examiner was asked to diagnose and grade image quality of each image based on the following grading system. We found that the image quality and diagnosis of contact lens fit was comparable between the two photographic devices. We found this device particularly useful as a teaching tool where recorded videos and pictures could be simultaneously viewed by the teacher and optometry or ophthalmology students and discussed. It could also be considered in teleophthalmology, where images and videos captured can be transferred electronically to be assessed by an experienced professional for further discussion and management. So, for your consideration, we give you Scooby Fit, a do-it-yourself mobile low-cost device that could be considered as an alternative to slit lamp for assessment and documentation of contact lens fitting. Thank you.
Thank you. I think it's a good idea to repurpose the cell phone for so many other activities. And good, you've taken it from the slit lamp, corneal ulcers, and then now on to this. What is the exact device that you fit onto the slit lamp?
It's a small device, sir. It's actually there's a blue acrylic sheet which is placed on the flashlight of the camera, and an intraocular lens is placed on the camera to magnify the image. So these two are placed together on the camera, and then we can just take the pictures.
So where are the cases where you had challenges in comparison to slit lamp? Was there any particular cases, deep set eyes or any of that?
Yeah, so the IOL depends on the IOL power and how much magnification you need. So I'm using a 20 adapter, so it's actually quite highly magnified. Probably for contact lens fit or probably a little bit higher power, we'll be able to keep it a little bit back also and get a very clear image. This one, it has to be magnified, so the depth of focus is very short. So a little bit movement and it will change the focus. So that's where the challenge is. But if you change the IOL power, then it shouldn't be an issue, sir.
Good. I think it's a good innovation.
Thank you, sir.
How it will be useful for teleophthalmology? You mentioned one slide, teleophthalmology.
Yeah, so teleophthalmology, what I mean is, if there are other centers where there are no cornea specialists or doctors who want to kind of assess this, if they can sort of electronically transfer the images and videos and get an assessment from a more experienced person.
To share the experience, you mean?
Yes.
To share the experience among the
Yes, sir. So in that way, it could be used, sir.
Okay.
So the judges, please note, you all have specific topics to ask questions to. Each of the judges have been given specific topics because I think we will not be able to complete if all the judges ask. All judges will mark all, but will ask for specific questions. It's on the group.
Right.
So for the discussant for the next one, thank you so
Thank
much. Yeah, the discussant, yes, sir. Please collect your certificate.